Everyone, welcome to researchmd.com. We're going to continue our topics on antibacterial antibiotics. Okay. Again, my name is CHERIYATH. I'm a physician practicing in the United States, program director, internal medicine residency, transitional residency, associate professor of medicine, 2 large medical schools. So let's get into our topic. So today's topic is about the antibiotic which work on the target is a cell envelope. Remember that. The target is the cell envelope. The number one antibiotic was discovered in the 1900s by Alexander Fleming, started with the penicillin, right? So we're going to look at penicillin and the class of drug in that group today. Okay, when you talk about the penicillin, it's important to understand the structure of the penicillin. Very, very important. Okay, 4 things you need to know when you come to the structure. Number 1, you got this beta-lactam ring. Very, very important. Please refer to our video we did a couple of days ago about the beta-lactam ring. How does it work? How does it form the resistance? It's very important when you talk about the penicillin, okay, because it can produce a lot of resistance and a lot of issues. The second thing we need to know, it's called a thiazolidine ring over here, okay, and then the third thing I want you to know, there's a sulfa group right here, because why is it important? There's a lot of sulfa. The patient with sulfa allergies, but you cannot use this drug, okay? They can cause a lot of problems to the patient, allergic reaction. And then the fourth part is very, very important, is this R group attached to it, okay? Why is this important? Because remember, it's a variable side chain. A lot of new drug they make now because they make this variation in the R chain, so it works on it, okay? So now we're going to look at it. We got natural penicillins, we got anti-staphylococcal penicillins, we got amino penicillins, and we got extended spectrum anti-pseudomonal. So let's start with our natural penicillin, which is the one Alexander Fleming kind of extracted from the penicillin mold. There are 2 we have to know, penicillin G and penicillin B. Look at the first one, narrow spectrum. Okay, we cannot use it on many bacteria. Just got a very narrow spectrum. Yeah, they're penicillinase sensitive, right? What does that mean? Bacteria produce this enzyme called the penicillinase and destroy the beta-lactam ring, right? Once the beta-lactam ring is gone, it's not going to work. Okay, so it's sensitive to penicillinase, remember that. So 2 drugs we know, penicillin G and penicillin B, okay? And let's look at which category they work. Gram-positive, okay, let's look at the gram-positive. It works on streptococcal pyogenes, streptococcal viridians, some strep pneumonia, some enterococci, and listeria monocytogenes. So those are the gram-positive spectrum. Now let's look at our gram-negative spectrum. Neisseria meningitis, and some H influenza, it also works. Okay, and then when you talk about anaerobes, it works on Clostridium species, but it's not going to work our main problem in the hospital, which is Clostridium difficile. Okay, it's not going to work, but it will work on actinomycetes, and the spirochetes is very important. So it works on Treponema pallidum and Leptospira species. Okay, so if somebody have like a syphilis, that's your drug to go to, and somebody have like rat fever, right? This is the drug to Leptospira is very important. Penicillin work. A lot of other countries, because of the rat fever, they can use that. Now, one thing we also need to know, penicillin G, you got a benzyl ring, and which is like hydrophobic. Just remember that. Now, the reason we cannot use these drugs on many of the other bacteria, because remember we talk about the beta-lactam resistant. When we talk about the beta-lactam resistant, there's 6 P's we need to know. 1 is penetration, the other one is sporing, number 3 is pump, number 4 penicillinase, number 5 penicillin-binding protein, and number 6 is the peptidoglycan. Remember the 6 P's of beta-lactam resistance. So let's look at each one, okay? First one is what? Penetration. So what happens is like these drugs have not enough penetration to the human cell through the cell wall. Okay, so what's going to happen? So it's not going to work the extracellular organisms, especially Rickettsia and Legionella, because they are the intracellular, but it will work on the extracellular organisms. The second thing is the porin. Some of the bacteria make this porin, which is not going to allow this penicillin to enter into the cell and destroy the bacteria. Example like E. coli, Proteus, Shigella, Salmonella. Okay, because they work because of the problem with the pump. Problem with the porins. Okay, so the porin channel is not going to allow the drug to get into the bacteria. Number 3 is the pump. Very, very important. You got this efflux pump in the bacterial cell. It starts pumping out some of the antibiotic concentration. So they make sure less antibiotic concentration inside the cell. Especially is important because the pseudomonal, this pump is very strong. You keep on pumping all the antibiotic out of the cell. So how does it work? It's not going to work. So do not use in pseudomonas. Okay, and the other P we talk about is the penicillinase. Okay, a lot of gram-positive and gram-negative produce this penicillinase enzyme that destroy our beta-lactam ring. Very, very important. Okay, next thing is the protein-binding protein. Some of the bacteria produce this protein-binding proteins which does not have enough affinity for the penicillin. Beta-lactam ring should be attached to this penicillin-binding protein, right? It's not going to work. So, and the other thing is like some bacteria is missing the peptidoglycan. If they don't have peptidoglycan, this beta-lactam is not going to, will not be able to destroy the bacteria. Example is mycobacteria. Next group of class penicillin we're going to take a look at is anti-staphylococcal penicillin. Remember, staphylococcal, okay? Very narrow spectrum, only on staphylococcus. It's not going to work on your strep, it's not going to work on enterococci, anything like that. So again, very narrow spectrum. Look at the gram-positive, some staph and some staph epidermis, okay? Now, they are also penicillinase-resistant. That's a good part because penicillinase, bacteria produce this penicillinase enzyme to destroy the beta-lactam ring. So this is penicillinase-resistant. Let's look at the drug. You got napsicillin and oxacillin, which is given IV or IM, and dicloxacillin you can pretty much give oral drug. Okay, so again, we talk about the gram-positive, some staph aureus and staph epidermis. The thing we need to remember about this R group in this drug is very bulky. If you look at it, right, that's the way it just kills the bacteria. That's the mechanism. So the R group is very bulky. Okay, now there's another important point in this group. This drug is not going to work against methicillin-resistant staph aureus or methicillin-resistant staph epidermis. Two major bacteria out there, right? So it's not going to work on MRSA or it's not going to work on MRSC. The reason for this bacteria, MRSA and MRSC, produce this protein-binding protein, which is now going to allow this beta-lactam ring to bind to it. So next group, main group, we're talking about aminopenicillin. Remember the word amino. So it got an extra amino group compared to this. Look at our structure of the natural penicillin. We have an amino group attached to the side chain. Okay, so that is the word, that's why they call aminopenicillin. And remember the word wide spectrum. So compared to this, the spectrum has increased, so more drug is got a coverage. Because of this aminyl group is attached to, they are allowed, they can go through the sporins and enter in the bacteria and kill them. So they're very effective against enterobacteria here. So E. coli, Proteus, H. pylori, Salmonella, Shigella, they can cover. Okay, so that's the difference between. So it's good to understand the difference between natural penicillin and aminopenicillin. Okay, natural penicillin, look at the structure, doesn't have the aminyl group. Over here, you got aminyl group attached to it. All the other thing is like pretty much same, but enterobacteria is covering and spirochetes in the Borrelia. is covered Borrelia right here, okay? So let's look at the main thing again. It's wide spectrum. It's a penicillinase sensitive. So penicillinase easily can destroy this drug. So bacteria produce this beta-lactamase enzyme or penicillinase enzyme which will destroy the beta-lactam ring. So that's why some of these drugs will not work on some of the bacteria. The main class of drugs we use is ampicillin, we give IV, and amoxicillin oral. And let's look at the spectrum one more time. We got gram-positive, Streptococcus pyogenes, Streptococcus viridans, some strep pneumonia, some enterococci, Listeria monocytogenes, gram-negative, Neisseria meningitis, some H. influenza, E. coli, Proteus, H. pylori, Salmonella. Because of this amino group added, they cover the Enterobacteriaceae and anaerobes, Clostridium except C. difficile, and the spirochete we got Borrelia. Now, what we did is we want to make this drug a little bit more stronger. So another drug was added to this, aminopenicillin plus beta-lactase inhibitors were added to the aminopenicillin to make new drugs to make it stronger. So we need two of this combination. One is ampicillin plus sulbactam, which is given parenteral, and you got amoxicillin plus clavulanic acid, which is given oral. So what does the spectrum do? Its coverage include more gram-negative, more anaerobes. Example, bacteroids will be covered. Now let's look at our last class, which is very, very important because now it's getting more stronger and stronger, right? So the extended spectrum anti-pseudomonal. Remember, anti-pseudomonas infection is getting very common and it's very resistant to treat. So the last class, extended spectrum anti-pseudomonal, wide spectrum, extended spectrum. So coverage is like more when we talk about it, okay? And then you make this by adding extended spectrum to beta-lactamase inhibitors, you can make it more stronger. Very, very important, especially, the drug called Zosyn we use, which is piperacillin plus tazobactam, okay? Now, let's look at, again, we talk about the wide spectrum, they're penicillinase sensitive, right? So that means penicillinase is the enzyme bacteria produce the beta-lactam ring. So so this is very good against the bacteria. Now, piperacillin, you can give parenteral, and tricarcillin, you can also give, it's both given like IV or IM, okay? Nothing oral right here. Now let's look at the coverage over here. We talk about gram-positive, Streptococcus pyogenes, Streptococcus viridans, some strep pneumonia, some enterococci. Now, gram-negative, we got Neisseria coverage, some H. influenza, some Enterobacteria, and remember the word Pseudomonas coverage, very, very important, right? This covers it. And anaerobes, it covers Clostridium, but no coverage against C. difficile, remember that. Now, and then we talk about, it covers some bacteroids. Now, to make this a little bit more potent, what we do is like extended spectrum is combined to beta-lactamase inhibitors, which one is piperacillin is added to tazobactam, tricarcillin, you got clavulanic acid, your coverage goes up. You got more Staph aureus coverage, you got Listeria monocytogenes coverage, and most Enterobacteriaceae, we talk about E. coli, Proteus, Salmonella, and all of this will be covered right here, and the Borrelia. So, how does this work, this extended spectrum? They make this, the penetration to the cell is much more better, and they go through the sporin more easily into the bacteria so we can destroy them. Okay? So remember, those is very, very important class, especially the drug piperacillin was tazobactam, very potent. The trade name is Zosyn, we use it. Thank you so much for watching our presentation. We'll be back with another presentation soon. God bless.